Hello, welcome, good morning, everyone. My name is Jason Langley, and I'll be your host for today's webinar. Thank you all so very much for taking the time to spend with us today. Um, we'll wait a few more minutes for a few people to join the call, but in the meantime, I can go ahead and introduce some of our guest speakers today. We have three excellent guest speakers. First, we have Charlotte Lemery, specialist criminal and road regulatory lawyer and founder and partner of LMP Legal. Charlotte brings extensive experience working with employers, operators, and professional drivers across the transportation and logistics sector. We're also joined by Stuart Osmond, director and insurance and risk expert at WTW. Stuart will be sharing his expertise on how insurers view workplace risk, particularly when it comes to drug and alcohol policies. And finally, we are joined by Doug Heath, Vice President of Sales at Intelligent Fingerprinting. Doug will share his expertise on fingerprint drug testing and how it fits within the modern drug and alcohol testing policies. Would you guys like to say hello? We can start with Charlotte.
Hi everyone. Hopefully you'll gain quite a bit out of today. So obviously if you've got any questions, then I think there's a good Q&A at the end, and feel free to reach out to me or to Stuart. But looking forward to presenting to you all.
Perfect.
Yeah, good morning everyone. Likewise, can't see your faces, but nice to meet you all. And by all means, do reach out to us if there's anything we can help you with afterwards.
Yeah, good morning everybody. Thanks again for joining, and more importantly, thanks to Charlotte and Stuart as well for what I'm sure is going to be a really informative webinar for us all. So thank you.
Perfect. So over the next 45 to 60 minutes, we're going to deep dive into the critical elements of effective drug and alcohol policies, why they fail, what makes them legally defensible, and how we can enforce them in real-world settings. Together, we're going to take you through the landscapes, highlights, key considerations, and answer all of your questions that come up. Yeah, we're going to explore quite a few things. I think that we can probably get going here. We can just jump into an overview of what our agenda looks like for today. We'll begin by looking at why drug and alcohol policies fail, legal and financial consequences that can follow. Then we'll move on to what makes a policy legally defensible, covering some key elements of clarity, fairness, and consistent enforcement. After that, we'll look at how fingerprint drug testing fits within that strong policy. And finally, we'll wrap up with a Q&A session where we'll answer any and all of your questions. A bit of housekeeping before we start. This session is being recorded, and we'll be sharing the link with all of you afterwards. Also, please feel free to submit your questions in the Q&A box throughout the session. We'll address as many of your questions as we can, but if a question comes up later, or if we don't have time to answer all of the questions today, we'll be sure to share all of our contact information so you can reach out to us directly. With that, I can hand it over to Stuart to talk to us about why policies fail.
Thanks, Jason, very much. Well, I guess this is we talk about this quite a lot, although insurance broking is separated from drug testing and things like that. Insurers are looking more frequently at what fleet operators and policyholders are doing in terms of managing their risk profile, and this one comes up quite a lot. We see a lot of, in my world, fleet operators. I'm working haulage, logistics, and commercial fleet predominantly, as you can see from my little sign behind. And we visit fleet operators week in, week out. And what we typically find, and I think this is probably not just in the fleet world, but construction, other areas, everybody in their driver handbook identifies drink and drug as a risk to the business. And yet, when we dig a bit deeper, and what you're doing to manage that risk, that's when we start finding things unravel. Everybody has a drug policy within their driver handbook or in their HR handbooks, and what you then do to manage that is really key. So you should be undertaking random drug testing. That means not just your drivers or your warehouse operators, but office staff, blue collar, white collar, everybody, and it needs to be a selection of staff. You don't have to test everybody, but you should be testing a percentage of your business. The way you do that could be around staff numbers. We had a discussion with a prospective client yesterday, and they were saying that everybody's payroll numbers go in and they pick ones out randomly. Sometimes it's ping pong balls in a bag, but everybody has the opportunity then to be randomly selected for drug testing within the business. The reason I've engaged with intelligent fingerprint in the past is because during COVID, when people were swabbing and having to take tests from mouths, this is an easy administered process, and probably, I might say, a bit more cheap than some of the alternatives out there. Other things we see is sometimes when men turn up on the gate and their white jackets and a table to check people coming in and out, drivers' WhatsApp groups might go and drivers start phoning in sick because they're worried about the consequences of getting caught, whether they've had anything in their system or not. So these are some of the areas we find, and it's typically not helping policyholders and businesses undertake everything reasonably practicable that is required of them to be keeping themselves on the straight and narrow. So some of this will come into the law side. I'll let Charlotte go in a minute, but once she starts, we might not stop her. But the fact is that everybody identifies a risk, and not everybody is managing that risk effectively. Any thoughts, Charlotte?
Several. So as you said, so I think just to digress a bit, we just want to talk about the scale of the problem, I think. So if you look at statistics, so kind of going back, we have the most, we don't have 2025, but you've got 2024. And then comparing that on 2023, there's been a 16% increase on drug driving convictions and prosecutions from 2023 to 2024. The alcohol-related convictions have remained steady, but they haven't fallen. So in terms of the scale of the problem, we know that drug driving and drug use has increased, certainly since the pandemic. And when we talk about drugs, we're not just talking about illegal drugs. So it's really important to understand that actually we're talking about medication, and that you absolutely can still fall foul of drug driving. And it might sound an obvious thing to say, but you can fall foul of that in terms of legal drugs, but actually ones that potentially affect your driving. And there is also a list of drugs that I can share the link with Doug afterwards, and with intelligent fingerprints, so they can send it out to you. But there are some that you need to be telling the DVLA about, or that you need to be certainly advising, or your driver should be advising their employers about. You also need, just for your own records and potentially for your policies, you should always carry your prescription with you, whether that be digitally or paper copy, and you could fall foul of an offence if you don't do that, if you are on any drugs prescribed by your GP or otherwise. So just in terms of the scale, we know that we're seeing it. We know we're seeing it on the increase. And I think then to go back to Stuart's discussions about policies and where we see the problems or where we see the failings, well, there are a few areas, aren't there? Because actually there are some businesses that actually will say to me, we don't have one. That is still quite common. We don't have a drug and alcohol policy. It's illegal, isn't it? That's kind of where we get to. So sometimes you have that it's not actually really written down. Or it's kind of, they have one, but they don't do any testing. So really it's, or they might say it's just with cause. Okay. And that there are a lot of businesses that still run like that. Sometimes we have companies, and I know Stuart's seen this before, where we will have policies that are, I would say, on the shelf, but that's very old fashioned, maybe on the cloud or whatever, however it goes these days. So there are policies there, but they're there and drivers don't always know about them. They haven't always signed to say that they've seen them, or certainly not recently, and they're not necessarily being implemented. So you might have a policy that says we test a percentage every month or every quarter, but actually there's no evidence of that. There's no evidence that that's actually being done, because some employers find it extraordinarily difficult to do. They find it a confrontational thing. It's a bit awkward. And I think in some industries, and it may well be relevant, if you're sat there thinking it may be relevant to you, it may not, but there are difficulties getting drivers. Okay, so commercial aspects play into it, don't they? Where you think, well, we don't want to put people off, or are we able to do this, and how do we do it? And actually, it just kind of falls by the wayside, and we're not doing it. And the problem with that is that if you have something written in your policy that you're supposed to do testing, and by the way, my recommendation, I know Stuart's would be, and I know this is a recommendation from tribunals, is that it should be random. It should be whatever percentage of your workforce that you agree on, put in your policy, you need to enact, you need to do it, and evidence that you're doing it, and it should be top to bottom. So it should be absolutely everybody sitting at a desk to everybody driving, because you will find as well that there are other people driving, such as your company car drivers, grey fleet or whatever. So you need to do it top to bottom, but you need to evidence that you have done it, because if you have it in your policy and you're not doing it, and then something happens, or you get investigated for whether it be a collision, whether it be anything, and a health and safety offence, whatever it might be, and the authorities are crawling all over you, if you can't evidence that you've actually followed your policy and you're implementing it, then you're going to leave yourself wide open. So in terms of why policies fail, they fail because either they're not there or quite good enough in the first place, or if they are there, they're not necessarily being implemented all the way through. And it's something that I say quite a lot, is that you can find yourself in front of a magistrate, a Crown Court judge, a traffic commissioner, whoever it might be. They're not going to say to you, can you tell me what you do in relation to drug and alcohol testing or health, safety and compliance, because that's obviously what it relates to. They're going to say, show me. And if you're not able to evidence it, you're really going to struggle in terms of showing your overall attitude to health, safety and compliance, because this is a growing problem, and it's something that if you run any kind of fleet or any kind of workforce, you're going to need to prove that you're doing everything, as Stuart said, reasonably practicable. Why have we picked that phrase? Well, that phrase is lifted directly from the Health and Safety at Work Act 1974. So it is your duty to do everything that was reasonably practicable. Well, what does that mean? Well, I can tell you it absolutely will mean having a policy and following it through, because unfortunately for employers, there's almost always something that you could have done, right? With the benefit of hindsight, it's stacked up against you a little bit, but you're not helping yourself if you haven't done kind of the basics. So I think that's kind of leads me nicely to where you were, Stuart, is that what we need to show in order to make sure that at the very least your policies are where they need to be, and that you're going through with everything that's actually written. Don't set yourselves up to fail, is what I would say. Don't put something in there that you're not going to be able to do, because I think we've seen that as well, haven't we, Stuart?
Yeah, it should be smart and achievable. It shouldn't be overly onerous. It's not particularly a big and wordy section within a driver handbook or an employee handbook. It should be sort of short and punctual. There should be some penalties in there. If you don't abide with this policy, this is the penalties of the business will apply. I guess just touching as well, Charlotte, you mentioned obviously medical prescribed drugs, although probably not such a big thing now, but hay fever remedies through the summer are a big issue. A lot of those cause drowsiness, and many of them will say don't drive or operate machinery whilst under this medication. So that's something that should be factored in. The slide here obviously talks about consequences as well. If one of your drivers has an accident, God forbid they've hurt somebody, a third party, or worst case killed a third party, and they're found by the police at the roadside to be intoxicated we're talking drugs here mainly. Often you can smell if people have got alcohol on their breath. Drugs can be in your system for 4 or 5 days before, long after they've taken, they can still be in the system and over the intoxication levels. If your driver kills somebody and the driver swapped by the roadside found to be intoxicated, the police and the authorities are going to come back to you as a business to find out what you've done to prevent that driver getting behind the wheel. Have you done everything reasonably practicable, the bit that we keep referring to check that your drivers, your employees haven't been in the workplace? And it's not just drivers, it's not just construction workers. We've got warehouse workers, people operating machinery. If some of those staff are found and policies are found to have failed or not been managed in the first place, the authorities and traffic commissioners and the police are going to start crawling all over your other paperwork, your other documents, record retention, to find out what else you aren't doing. And before you know it, they're going to be picking holes in all sorts of other policies and procedures as well. And when they find that the business is a bit of an epidemic, that policies are in place and not followed, you start to go down the legal process when you need somebody like Charlotte to defend you, and you're going to be in court in front of the traffic commissioner, in front of all sorts of other people, defending why your actions have resulted in somebody losing their life. And the ramifications of that are obviously huge fines and penalties, the sentencing guidelines, which I'll let Charlotte explain, depending on how big your business is, how big the fines and policies are. And reputationally, you're going to be hauled through the press. So there's a lot of consequences, and it's easy to remedy by having the policies and managing that effectively in the first place.
Yeah, because I think we've come a long way from thinking that a road traffic collision or anything else, or an accident at work or whatever else, is just that person's problem, because clearly it's a problem for the business. And we talk about, and you've talked about it well there, Stuart, that if if a driver or an employee is found, something happens and they're found to be kind of over the drink limit or over the drug limit, then obviously they're going to come and look at your records and what you were doing, and whether you were testing, whether you're following your own procedures and policies. And as we've said, in terms of consequences, the sentencing guidelines, yes, that they're not a secret. They're easily accessible in terms of the Health and Safety at Work Act and the prosecutions and the fines that you can face. They are dependent on the size of your business, but importantly, they are based on turnover and not profit. So you can think to yourselves how that might look, but they are well capable of shutting a business down. The level of fines, it's unlimited fines now in the magistrates' court. They have those powers, and we are seeing it. I have seen more and more where companies investigated, either where a driver has failed a roadside test, or obviously it has happened in the workplace as well. And even if they're not always prosecuted, it's a very lengthy, stressful and expensive investigation. And obviously there are some that are prosecuted as well. So I think it's worth knowing the cost of implementing a drug and alcohol policy and testing is negligible compared to the cost of not doing it. And I think it's probably worth mentioning at this stage, Stuart, that at the moment, this isn't mandatory, okay? At the moment. But you may or may not be aware that the DFT, so the Department for Transport, in 2024, did commission a report suggesting that mandatory drug and alcohol testing regimes for kind of commercial operators might well be introduced, and the DVSA is reviewing kind of licensing and compliance frameworks in light of that as well. And there might well be a public consultation, and I suspect there will be, launched next year. I can only see this going one way. Okay, so we're not saying it for certain, but I can only see it going one way. I think it's quite likely that at some point this will become something that is a legal requirement or something that is mandatory. And I think doing it or preparing yourselves beforehand, if you don't have something in place, is probably better than waiting till you have to do it and you're kind of under time pressure. So I think if you don't have something, I would look into it. And I would get yourselves there, because I think at some point that is the direction of travel. That's what I think.
I was just going to add, Charlotte, as well, that if you're a driver or an employee and you've had that incident, you're definitely going to end up in court, health and safety tribunals, that kind of stuff. But the important thing here is it's not just the employee. If you're a director of a business that's failed these policies, you're going to find yourself in court as well, and you're definitely going to need yourself a Charlotte then to defend you. So it's not just an accident anymore. Unfortunately, if an accident happens and somebody's killed, it's not deemed an accident. It'll be a workplace incident, and a number of authorities will crawl all over the business to work out what could have been done to avoid this, which is natural, and I think we agree that's warranted.
That might be a pretty good opportunity for us to shift here into some, real world examples. I know both of you work closely with a lot of different organizations preparing and then also reacting to incidences. Can you share with us any case studies?
Yeah, I guess I've got quite a few really. I mean, because I was going to pick on this one because I think it's sometimes a misconception that kind of your drivers are going out having 8 pints, getting behind the wheel or whatever, or having drugs and then getting behind the wheel. But actually, it's not always the case. I see quite a lot of kind of morning after and on a Monday morning, that kind of thing. Where obviously it takes days to kind of get out your system. People might have partied too hard at the weekend and then you're seeing it afterwards. So sometimes it's kind of a lack of education. So the other thing that I would encourage, and this is an aside, it's not just about testing, but actually in terms of your overall policy, what I think is quite a good tip is that I think I would put some posters up around the workplace, try and do a little bit of kind of refresher training, toolbox talks on drug and alcohol, the effect of them, when it might come into play. And actually it's not always just before you do something. Obviously you've got to think about the next morning and how long it takes to get out of your system and those kinds of things, because I think that as a general tip does generally educate people in general who are coming to work who may be well under the influence. And I've had well, I would say it's probably about 18 months ago now, a case of a driver who was found to be under the influence of drugs. It was a Monday morning early. The employer did have a drug and alcohol policy. It wasn't, shall we say, it wasn't best in class, but it was there. And they did say that they did carried out random testing. Now, unfortunately, they just hadn't carried out any random testing whatsoever. So it wasn't even that they'd done a small proportion, they just hadn't done anything. And so they had no evidence that they'd done any of that. They just kind of let it slip. Things were busy. They couldn't evidence that the drivers had seen that policy and signed for it. Obviously, as a result, the driver went to prison for quite a long time because unfortunately it caused a death whilst he was under the influence. So he did go to prison for a long time. And the company was investigated and fined, and they were a smallish company, but they were fined a 6-figure sum. And I don't know, it was a lengthy, I would say 3.5-year investigation as well, all the legal costs associated with that. So that is simply from not being able from basically doing nothing. I've had another case where the driver didn't, well, fortunately they didn't, there wasn't a death, but they were caught again under the influence of drugs. And whilst the employer said that they did carry out random testing and with cause, they didn't have any documentation. So they couldn't evidence that they'd done anything. They hadn't kept a paper trail or anything on the computer. They just kind of said, oh yeah, no, we definitely do it. And we took witness statements to try to back it up, but ultimately it was showing a disconnect between what they say they did and what they didn't do, and they ended up being heavily investigated, improvement notices, and all of those kinds of things from the HSE. And obviously the traffic commissioner became interested as well. Something else to note, I'm sure many people know it, but if one of your drivers, even if nothing happens, if they are found to be under the influence, either from your random testing or if they are caught by the police, you have a duty to report it to the traffic commissioner as well, even if nothing's happened, as in even if they haven't hurt anyone. So just make sure that you follow through with that duty. Otherwise, you could be penalised as well. So yeah, they're a couple of my real world examples, but seriously, we are absolutely seeing that companies are penalised financially, and obviously then you've got the reputational effects as well. And look, we can't forget, what are we all here talking about it for in the first place? What do we actually want to prevent here? Yes, we want to protect our companies and everything, but we want to protect people on the roads. We're all road users, most of us. We want to protect people. We want to make the roads safer. We want to make sure that this behaviour goes down rather than up, and we want to make sure that we're doing everything that we can to make sure, as far as we can, that our workforce is safe to be on the road. So we can't forget the real human cost, can we? I think that's one of the main things for me.
Yeah, I mean, it's a big own goal, isn't it? If you're actually undertaking testing and you're doing the right thing and not recording it, and yeah, it's not written down, it's going to be an easy prosecution. Charlotte, before I give a couple of examples, did you want to just touch on, if you cause death by dangerous driving through drug testing, what the penalties are and the
well, it's life. Yeah, it's now up to life imprisonment. It changed in June 2022. So, you know, what was 14 years has now gone up to life as a maximum. We're not playing around. Road traffic offences carry really serious consequences, you know, for the individual. And ultimately, although it's not common, there is a possibility that directors and senior managers of the companies, it's not just the company that can be looked at, actually those people can be looked at personally. So if there is a death, there's gross negligence manslaughter that is sat there, that if an individual really has acted criminally negligently in terms of possibly what they knew, ought to have known, act or omission, those kinds of things, they can be investigated personally as well as the company. So I think it's, yes, there are offences under the Health and Safety at Work Act, which are more common, but we do have to remember on the outside of it, Stuart, as you say, there's corporate manslaughter, gross negligence manslaughter, and obviously the causing death by offences for the actual driver. So they are really serious in terms of where you can find yourself. So I think, you know, like, to me, I always say you can't control everything in life. It's just impossible. So you can't control whether this might happen within your company at some stage. But what you need to control is what you can control. So do everything that you can do to put yourself in the best position, and to put me or whoever your lawyer is in the best position to be able to defend you should the worst happen.
Control the controllables. Yeah, definitely.
Yeah.
Well, I guess some of our examples, you know, we've had clients where they've come back to us and said, we've got a bit of a problem, there's been an accident. Fortunately, I can't you know, touch wood, say that any of our clients have been in that fatality situation, but I've had examples where our clients have had to use Charlotte because a driver's let them down. Bizarrely, it's not always the driver you think it's going to be, it's the ones you least expect it's going to be. And this comes down to, you know, some welfare in the workplace. Are you keeping an eye on your employees? Is there stuff happening at home that's driving a different behaviour? As Charlotte touched on earlier, since COVID times, drug usage has risen. The testing that, you know, these guys and others provide is far greater, so that it's easier now to identify drug driving than perhaps ever before. And I think a lot of drivers don't realise they party hard on a Friday or Saturday. When they go back to work Monday, Tuesday, maybe even Wednesday, that might still be in their system, and they think they're well out of it. But some of the things we've seen, I've been to places where I went to one warehouse where the forklift drivers referred to as Pothead Pete, and asked the question, is that literal as the way I call? Oh yeah. He likes to smoke in his spare time. I said, well, he shouldn't be driving the forklift. You know, that straight away you should be getting him out of the workplace, doing some testing. Obviously that failed. Nothing came of that, but you know, we highlighted a problem. We've seen other issues where a prospective client of ours suggested that they would have to close their warehouse if they started doing drug testing. They'd lose half their warehouse employees. I suggested, maybe naively as an insurance broker, well, maybe they're not the people you want in your workforce. But yeah, we can't do that because we wouldn't have any guys left. We'd have to shut up for a few days until we got some more staff in. But these are moral issues to the business that perhaps then, if you if you were the authorities, you started scratching and you found out that, the business was aware there was intoxicated personnel on the workforce, one workplace incident, and those directors are going to be in court, as Charlotte suggested, defending themselves because it's gross negligence.
On that, Stuart, actually, you reminded me that I had one of my large clients. They had they drug and alcohol test. In fact, they do it on induction, and there were 13 drivers sent home on Monday. 13 out of, I mean, there were maybe 35 or 40 they're coming in that week. But I know that causes a problem. But to my mind, wouldn't you rather know? Wouldn't you rather know what could have happened? What could have happened with those 13 that ended up being sent home? So, it is an issue. It's a commercial issue. It's a logistical issue for companies, and it's one that I'm sympathetic to. But ultimately, we have to know, and we have to follow through with it. And unfortunately, if it's not done, one of the aggravating features on the sentencing guidelines is putting profit above safety. And, if you never want to have that leveled at you as a company, never. So you just need to keep on the right side of that.
Likewise, I guess, as well, I was speaking to an operator earlier this week where they're undertaking pre-employment testing. And I think more and more fleet operators now are maybe doing drug testing at the point of employment of drivers. We've heard of some where people say, well, can I come back after I failed a drugs test? That never goes down too well, and hopefully they're not invited back. And we found that some drivers would rather not work for an employer who has an effective drug policy, which is great, but we're just kind of pushing them down the road. And we were talking at an event yesterday whether or not some of these drivers should have something on their license saying they haven't had a drug test, or just something that flags up they've avoided or missed or failed without necessary black marking everybody. But maybe we're pushing the problem down the road sometimes, but that's the way it is at the moment. But we can only do what we can to make sure that those businesses that we're associated with are doing the right thing.
Perfect. Thanks so much. Great insights, Charlotte and Stuart. The next section that we can kind of talk about then, I think, Charlotte, we'll get a lot of your advice here, is what makes a drug and alcohol policy legally defensible. We previously talked about some criteria, and these are just some broad strokes, but can you take us through what in your professional experience makes a policy legally defensible?
I think, to be fair, we've probably skipped ahead because Stuart and I like that on slides, and we just kind of talk, and I think we probably have covered a lot of this. It is being clear. It's being detailed. A lot of the devil is in the detail, and I think you need to make sure that it is properly thought out, that you've thought about all of the pushbacks that you might get, to make sure that it's fair and across the board. As Stuart says, kind of do it top to bottom. Don't just focus on one area of the business. It needs to be throughout the business so that you can demonstrate it. I have some clients that say, well, we get a lot of pushback from unions and things like that. But I think for me, if it's clear and it's in the contract of employment and the offer letter that this is the terms of the employment, this is what the business does, then that person knows before they come in that that's what they do, and that's what they accept when they sign the documentation. So I think you need to make sure that you've covered yourself there. And obviously you can do with that in conjunction with working with your colleagues in HR, or if you get outsourced HR advice, then make sure that you do that. If you come across some really, difficult issues, I'm sure there are always, I'm not an employment lawyer, but there will be employment lawyers that you can work with who can help you with this. And I know many of the firms that I refer to absolutely do help companies with this and are navigating it successfully. But I would, not focus on one area, but say to the unions, look, this isn't about penalising, any part of any workforce. This is about making a safer workforce, safer drivers, safer warehouse workers, or whatever it might be. So it's actually trying to protect them from themselves as well. So I think, make it very, very clear. And I would do it in conjunction with some training and toolbox talks, because the issue for me often is that people push back against something that perhaps they don't always understand, or they think it's another thing the company are doing or expecting, or whatever it might be. But actually, if they've received proper training on why are we doing this? Why are we bringing this in? Or why are we suddenly enforcing it, or whatever it might be? Well, talk about the offences, talk about safety, talk about the effect it has on, your job, your life, your safety, your health. So I would do that definitely in conjunction with some training and make sure that's pushed out across the workforce. And also that's great evidence as well to take to any tribunal that you have trained your workforce on this. So I would do it in conjunction. And then, like we say, consistent application is absolutely key. And just make sure that you're doing whatever you set in your policy. I can't stress this enough, do it. So if you're testing 50% every quarter, do it. Okay, I'm picking that as a random number, but just make sure that you're following through. And that goes for any policy, not just this, but just make sure you're following through and make sure you can evidence that you followed it through. So make sure that you can clearly show, one, that you've done the training, one, that you've pushed the policy out and people have signed for it and understood it. And that then you are doing it and you're gathering that evidence each month or quarter or whenever your policy says that you are doing it. But like I say, we have covered most of it, but it's really just reiterating, if you don't do those things, you are going to find yourself in a difficult position at some point, because we know it's on the increase and we know that you will have people, even if they're not doing it deliberately, you will have a potential morning after problem at best, actually. So just make sure that you are following those rules.
And of course, we're coming into a time of the year where police ramp up their activities for stopping vehicles randomly. The Met Police in London actually have ordered something like 20,000 drug tests to make sure that when accidents occur in London, drivers are being tested more frequently. So if you're operating vehicles in London, you could be on the back of that. I mean, people might wonder why insurance brokers are interested in this stuff. This is what we call claims defensibility. This is making sure our clients are able to defend themselves as best they possibly can should the worst happen. And we often talk about worst examples. If somebody's killed as a result of somebody else being over the drug limit, you're going to want to make sure all your policies and procedures are watertight, so that when anybody starts scratching the surface, you can show them, as Charlotte just said, this is our paperwork, this is when we did it, these are the people we checked. You can overwhelm them with paperwork because you've got good record retention. And if you haven't, you're setting yourself up for a fall, and you're giving yourselves an easy chance of prosecution. So claims defensibility is a phrase I would use to back up all of that there.
Perfect. Kind of going off of that, we have talked about a lot of the worst case scenarios here. Do you have any case studies for some incident happening and things going, not well, but not horrifically?
Yeah.
Of course she does.
Fair few clients of ours that we've worked with over the years, and in fact a mutual client of myself and Stuart, we worked with them over the last 4 years, to not only develop the policies, but make sure they're implemented, make sure they've got a proper training regime and schedule. And we had last year, I believe it could have been last spring, there was a driver unfortunately stopped for and it was it was drug driving again, over the limit, and straight away we were able to spring into action. We knew exactly what the policies were at that company, and they were able to completely evidence that they had done everything that they could. So they could show that they had their policy was random checking, and they could show that they had absolutely done that every single quarter since I think it was 2021. And there was just, we were able to get a kind of bundle of evidence together really quite quickly to be able to send to the prosecuting authorities with a prepared statement, and it basically just completely shot it down before it started. So it was a cheap solution for the company, because they didn't really have an investigation. They had a question to answer that they could answer very, very quickly. Effectively, they won the case before it even got off the ground. And I think that's the key, that one, they see it a little bit less, because employees, it's the white coat effect, right? Isn't it? Employees know that they could be tested at any given time, and they also know why, because they've had the training and they have refresher training every year, and they're aware of what all the consequences are, but also of the dangers. So I think they've eliminated it to a point, but even where they hadn't, they were able to show that actually there's nothing further they could have done. they could have done to do it. So I think I definitely see, Jason, I see the good and the bad and everything in between. And I know Stuart does, because like I say, he does see it from the other side when, of course, he's kind of negotiating with insurance. We're talking about all the kind of risk, and a good risk and a bad risk, and and I won't pretend to know everything about that. That's far more Stuart's area. But if you can show that you're meeting that head on, and actually you're doing more than what is expected of you, you're going to be a more attractive proposition as well for your insurance. And I think, Stuart, that's right, isn't it?
Yeah, definitely. I mean, that's 100%. I think when we're talking about businesses, a case there Charlotte mentioned, being able to quickly show that they're doing anything reasonably practicable to defend those risks. If you're sat in front of a traffic commissioner and you can show you're doing, I'm sorry, I keep referring back to transport. I can't see all the people on the call, but I understand there's a transport and logistics demographic that's involved here. But if you can show the traffic commissioner you're doing everything you possibly can, they're not looking for they're not looking to throw the book at people that are businesses that are doing the right thing. They're trying to drive out the rogue operators. So if you can show you're doing the right thing, you'll get a clear bill of health. You're probably going to get away without any penalisation from the traffic commissioner, no restriction on your licence, that sort of stuff, and you'll be sent on your way with thanks for showing us all this, and you're going to get away without too much fines or penalties. But it's the rogue operators that the traffic commissioner is trying to squeeze out. I know the health and safety exec's slightly different, that they perhaps might push for more penalties, but again, if you can show that you've done everything you possibly can to manage that risk, the likelihood is you'll walk away free of any penalisation, penalties, enforcement.
Perfect. Well, building on this idea of prevention, I think that this might be a great point, Doug, for you to talk us through fingerprint drug testing and how that kind of fits in within these policies, these legally defensible and strong policies.
Yeah, absolutely. And I think it's really interesting what Charlotte and Stuart have been saying. Having a good, strong policy is incredibly important, how that policy is built and what you achieve through it, what you can evidence through it, so on and so forth. But really, I'd dial back to what is that policy trying to achieve in the first place. And I think the real reason for a good drug and alcohol policy isn't to catch people out, isn't to, find these things that are going wrong. It's to deter them from happening in the first place. If you catch someone that it's too late already, there's been an element of risk, they've been out and about, they may have drove to work, so on and so forth. So we want to deter drug usage in the workplace, full stop, and you're only going to do that through a strong policy, and a policy, as the guys have repeatedly said over this call, a policy that you actually enforce. If you keep telling someone they're not going to have their dessert unless they eat their dinner, yet they have pudding every night, they're going to keep not finishing their dinner. So making sure you enforce that policy and drive that deterrent is good. Now, the reality is, as we've already sort of spoke about, drug testing is often a secondary duty within a business. It's an extra expense within health and safety. It's, there's multiple factors through day to day that make these things difficult. So at Intelligent Fingerprinting, we try and make this process as simple and as easy as possible so you can effectively enforce your policy and achieve all of the things that the guys have discussed today. So we're not going to collect any bodily fluids. We're simply going to collect the sweat from your fingerprint in order to analyze that test. So we're not asking you to handle urine. We're not asking you to handle saliva. The test sits with a reader that analyzes those samples for you, taking away that sort of confrontation of testing a colleague or someone you may have a close personal relationship with and having to look, is it a clear line? Is it a broken line on the side of a cup, and making that decision. There's no white coats waiting at the door so people can run away when they see us there. You've bought it in-house, giving you full control of how you exercise it and allowing you to turn your testing on and off in accordance with the policy that you have. And that reader, I think one thing that sort of stuck with me over the course of this webinar from the guys is that reader is going to store all of your test results in it, and they're going to be time and date stamped with the individual results of that person. So we are your records keeper, and should you ever find yourself in an unfortunate situation, it's a simple export to provide that information and show that you're in in keeping with your policy. We have a short detection window focusing on fitness for duty. So we're going to have a better suggestion of impairment. We're not going to pick up things that people may have done a week ago. We're going to pick up that recent drug usage where people are likely to be impaired. So if you're thinking, it's interesting to hear it come from Stuart and not from on a sales call, that I'm going to lose half my staff if I start testing. You're going to lose some, but you're going to lose the ones that are putting themselves and other people at risk. We're operating with a scalpel as opposed to a shotgun. So I like to think, sort of in summary, we are making testing easier, simpler, and cleaner. It's a smarter way to do things. The simplicity of the system allows you to bring it in-house where you have full control. With that come enormous cost savings, with some of our customers, having increased testing by over 100%, yet seeing enormous savings in that first year alone. It really is, in my opinion, the smartest way to analyse your staff, keep in conformance with the policy, and more importantly, as I started off on this sort of message, drive that deterrent from people taking drugs in the first place.
Perfect. Thank you so much, Doug. Yeah, I really think that this idea of prevention has been a thread that we've been weaving through this whole talk. Well, with that, we can kind of move on to our Q&A section here. I have a few questions that people have put in. If you haven't put one in yet, please feel free to toss them in now. First question I have here. If the company keeps a record of employees that have pre-declared prescribed medication, would this negate the need for the employee to carry the prescription with them?
No, because it needs to be the police need to be able to see it, or if they're stopped. So it does need, it's good that the company has that record and they do need that record, but it does need to be, whether it's in digital form or otherwise, it should best practices with them.
Perfect. Nice and simple. Another one that we have here in the construction sector, we have subcontractors where where would we stand if they have an accident operating and if they're under medication, if they started out operating the machinery, but the operative has not informed us. So I suppose,
it depends whether you've asked. So it's all about asking the right questions and being able to evidence that you have. So again, we have a medical questionnaire. If anybody wants the template, then feel free to go through to Intelligent Pig Fingerprinting. They will have our details, and I'm happy to share a template for you that's best practice to be able to follow. Because obviously, if you've asked the question, it's not being declared, then again, you're showing you've done everything reasonably practicable. But if you just haven't bothered to ask the question, then you're going to find yourselves in trouble as well as the employee. So
the flip side, the employee should have a bit of responsibility here as well. It's not just all on the employer. If you know you've got a medical condition, you should be disclosing that to your employer. I think not just blame it on the insurer or the employer. So
I think just looking through the Q&A, I think the bulk of the question there was more to do with where they stand if it's a subcontractor that's not employed by them.
Well, if there's a subcontractor, I guess I'm not massive on construction, but if there's a primary contractor, they're probably going to be responsible for that health and safety on that site, aren't they? So the primary contractor should be implementing those risk assessments and policies and procedures that everybody on that site follows. I think that's how it typically works.
It is.
Perfect. Another question here. Employee has a coughing fit. Vehicle swerves off the road. They fail the police roadside test. Blood was taken at the hospital. It may take 5 weeks for results. We have no medical evidence to confirm that they were unfit so far, so they haven't been charged. Where do we stand allowing them to drive again?
So technically, they haven't been charged with anything. They haven't been convicted of anything. So what you would need is a medical to be done to declare them fit. So what you want to do is make sure, again, you've done everything to make sure that they are fit fit to go back on the road. In the same way that you would make sure a vehicle is roadworthy, you need to think of your drivers in the same way. So you need to have a fitness to drive policy. Hopefully you have one. If you don't, again, you need to devise one. And then you need to make sure that you get a clean bill of health from the hospital, stroke GP, and you might want to get your own occupational health, but you just need to make sure that you've got evidence that they are actually okay to drive. Now, it may be, by the sounds of it, that then they're not. I don't know whether they'd be given, if tests are not back yet, whether they would actually be given the all clear in that circumstance. But you do need to make sure that you've got all of that from the medical professionals before you allow them back on the road.
There is a bit of a rare condition, isn't it? Is it scopy or scopa or something like that? Syncope, that's it. I can remember the name. But you can actually cough yourself unconscious, and it's been seen on a few London bus routes where I think we had a bus client where there was actually a nurse had recognised that the driver was coughing loud, and he actually had a sudden fit whilst driving and lost control of the vehicle. So this sort of stuff can happen. You definitely need to go through the medical conditions, and as Charlotte said, get yourself signed off by medical practitioners as to whether or not you're fit to drive in that scenario.
It is a recognised medical defence, so I have defended successfully a few people that have been charged with death by dangerous, death by careless, and things like that with the cough syncope. So it is, you know, recognisable, but you do need to make sure that you've got everything before you let them back on the road, obviously.
Similarly, we've seen examples of some drug testing procedures where the driver might be tested in the workplace, fails that test. So the business might send him home that day, him or her, and then they send the test off. It might take 2 or 3 days for that test to come back. And we've seen cases where the driver's allowed to go back out and drive while they're waiting for that test. Now, I'd suggest that's a big no-no. If that driver's failed a test, he shouldn't drive again until he's got a clear bill of health. And obviously, the next step of undertaking a proper drug test via a laboratory has been undertaken. So we certainly don't want to be putting drivers back out there if they failed a test until they've improved they're clear and okay to drive. But there's been some examples of that, which is a little bit alarming.
Next question here. If a test is negative, and are we legally allowed to save clear test results as a random test? Can we legally do this? How can we prove that we're random drug testing, I think, is the real crux of the question here.
The random drug testing would come from record retention, wouldn't it? You'd have a list of whichever employees have been selected, what the tests were. Ideally, the employee signed to acknowledge the test, so we're all on the same page. It's that simple. It's an administrational task. You mentioned something there about, Jason, about keeping tests.
That's
probably one for Doug, I think, in terms of what the GDPR is around all of that. I don't know. Sorry, Doug, I'm throwing you under the bus here.
No, it's okay. The question was, if a test is negative, can they legally keep those results? So what we would always advise is they keep. I'm stumbling on my words here. What we advise that any data entered into our system is anonymous from that individual, so it's a number that can be tied back, but it can't be immediately identified to that individual at first glance if someone wants to get access to the reader and things like that. So there's no issue in the reader storing those. It's fully GDPR compliant, and it allows you to have the ability to evidence that you're doing your testing.
That'll just be kept by codes and numbers on the test, would it? In terms of you keep the number rather than the name on the Okay.
Absolutely, yeah.
Perfect. One more for Doug here. Does fingerprint tests identify medical cannabis?
So we detect THC, which is the psychoactive analyte of cannabis, or the bit that gets you high, for the non-scientific people here. If it has a THC content within it, we will detect it, absolutely. We're here to detect drug metabolites above or below a defined level, not to say how they got there. It's important to be able to detect these in the same way it's important to be able to detect certain opiates that may cause sort of driving issues and things like that. Just because it is medicinal doesn't mean it's not going to put you at risk or make you unsafe on the roads. So yes, we could detect medicinal cannabis, absolutely, but I would argue that is something you would want to pick up and check whether it's in line with any prescriptions and the people that are taking that particular substance are safe to do so within the role they're in.
Perfect, thank you. One more here. If a worker is asked verbally if they're taking any medications as part of their induction, and they don't disclose this information, is that enough due diligence by the company?
No, it's verbal. You can't evidence it. So what I would say is just put yourself, every single time you're thinking of something, put yourself in the dock. It's the easiest way to think, how would I evidence it? What would I say? What could I show? So everything needs to be written down, signed for, proved, because obviously, you know, there's no independent proof that that's happened. That's just relying on a tribunal believing you, and that's, you know, that's less believable, and you know, if something's happened, isn't it? So just make sure everything is evidenced, written down, documented.
At the very least, you would want to just record that conversation, wouldn't you? This is what we discussed, and
Absolutely.
both parties sign. That's the minimal requirement, just to make sure that you've covered yourselves against that employee letting you down at a future stage, because that can happen.
Another question here about levels for alcohol. So England has a different level than Scotland. It's a higher amount. If a worker was found above that, below the English legal limit, legally, can they drive home? Challenges to disciplinary broken employer policy, but not the law. Sorry.
I'll help you out there, Jason, because I read this one earlier on. So
Thank you.
Obviously, the English drink driver level is at 35 and the Scottish is at 22. If they've set their policy at the Scottish level, but they're operating within England, and the driver fails the test, but yet still remains below the English drink drive level, are they exposed if they allow that person to drive home?
Well, I think your policy should be zero, shouldn't it? I mean, obviously, yes, legally there's a limit, but the company policy should be that there's nothing. Obviously, if they fail it, it depends where anything's happened. So I suppose if you're in Scotland and you are below the level, then you're below the level, aren't you? You've not technically broken any laws. So it depends where you are. So you have to set it for where you are.
I guess the question here is, if you're in England, you're a Scottish driver and you record 30 rather than 35, but you're a Scottish, it's going to come down that jurisdiction, isn't it?
Yeah.
Where if you're in England, you're responsible for the English, so you may be over the Scottish, but if you're on English territory, then you'll be fine to carry on your journey. But I'm sure it's a fine line between 22 and 35, isn't it?
I think so, yeah. I think it's a very fine line, and ultimately it's the jurisdiction in which you're stopped or travelling or whatever it is. So if you know that your drivers are going into to England, then you need to set your policy accordingly. But
is the talk of zero tolerance across the whole of the GB, I think, isn't it, at some stage?
Yeah, I think so.
I think we have time for one more question here. If we test and the result takes a week to come back, is this okay for the driver to keep on driving?
No, that's the bit we talked about just now, Jason. I think if somebody's failed that test, I mean, if they pass, of course they carry on. But if you failed that test and you then have to send off for a laboratory test and it takes a week longer, that driver can't drive. He shouldn't be left with any company vehicle. You really should be discouraging him from driving his own car home if that's the case, but I understand it's a bit of a challenge. But you can't have drivers driving on your company policy or insurance policy whilst there's a question mark about their intoxication. That came back to what I said just now about one of our contacts was allowing drivers to go back out the following day whilst they waited 2 or 3 days for the test to come back. If you have an accident in that time, knowing that somebody's failed a drug test, it's a clean hit. The authorities, again, they're going to drive a bus through it. Happy days. This is a nice, easy one to pick up. But I think if somebody has failed a drugs test, until they're proven to be clear, they don't drive under your company policy.
I think I'd just sort of jump in there as well, because if it's not clear from this particular individual if that's on the basis of a screen or a laboratory. If you aren't operating a drug testing regime that gives you an instant result on a screening basis, I strongly encourage you to start doing so, albeit through us or any other matrix, just for the operational efficiencies that you're going to gain. There's no need to wait multiple days for those results to come back. You can gain that intelligence straight away. With us, it's a maximum of 10 minutes. You can test multiple people, up to sort of 6 people in less than 15. And our current lab turnaround times are averaging just over 3 days at the moment. So there's certainly some savings in that. You shouldn't be waiting a week for those results to come back, regardless of what testing method you use.
It's quite a long period, isn't it?
It is indeed.
Perfect. Well, thank you all so much for your insights. I think that that's all the time that we have for questions today. We have some questions that are unanswered, but I will make sure to share these with everyone within this call, like Charlotte and Stuart and Doug, and we'll be reaching out to people directly to make sure that all of your questions are answered. In summary here, really, there's, some key takeaways. Evaluate your current drug and alcohol policy. Use that to guide your testing. We want to prevent things. We don't want to have anyone under the influence of anything driving on the road. Thanks again so much for coming to today's session. We look forward to continuing this conversation with everyone. Please feel free to reach out to us directly if you have any questions further on fingerprint drug testing or alcohol and drug policy. We're always happy to help. A big shout out and a big thanks one more time to Charlotte and Stuart and Doug. Really, really appreciate you guys taking the time today to join us.
You're very welcome.
Thanks for the
everyone.
invite. Yeah.
Thanks, guys.
Thank you,
Thanks
everyone.
very much.
Thanks, everyone.
Take care. Bye-bye now.
Cheers. Bye,
Bye-bye.
guys.